Member for Moncrief.
Thank you, Mr Deputy Speaker. Well, Mr Deputy Speaker, I'm certainly pleased to have the opportunity to speak to this legislation, the Fairer Private Health Insurance Incentives 2009 Bill, because contrary to the title, this is not about fairer private health insurance at all. And it's only one party, I should say it's only two parties, the Liberal Party and the National Party, that will stand up for private health insurance in this parliament, Mr Deputy Speaker. The only people with the form and the track record of delivering for those Australians through an incentive scheme to ensure that those that can afford to provide for their own private health insurance do, and that's the Coalition. Now, we know the great pretenders that sit on the government benches for quite a while ahead of the last federal election claimed to the Australian people falsely that they would stand up for private health insurance. The Prime Minister himself, Mr Deputy Speaker, remarked in his words, his promise, which he uttered on the 22nd of September 2007, was, and I quote, "A Rudd Labor government will retain the Medicare safety net as Australian working families have come to rely on it for help with their family budgets." He also promised not to do anything to attack the 30% rebate. But what do we now see after only 18 months of the Australian Labor Party in government? We see the same ideological attack dogs in the Australian Labor Party go for the jugular of private health insurance and the Medicare safety net. We know as a party that the Australian Labor Party has an ideological problem with private health insurance. And this was, I guess, most accurately reflected upon by Graham Richardson, the former, of course, Labor Health Minister, a man who understood the importance of private health insurance incentives. After he lost office, Mr Deputy Speaker, he remarked, on the Labor side, of course, they simply do not want to acknowledge that private health care matters. There is an ideological bent here that says Medicare is perfect, which is ridiculous. Therefore, it cannot be changed, which is also ridiculous. Therefore, nothing should be done about private health, which is also ridiculous, because the one thing they don't want to acknowledge is that private health insurance matters. They're the words of a former Labor Health Minister, a man who intimately understands the beating ideological heart of the Australian Labor Party. The government that now has dictated, under the reforms and the broken promises that they have delivered in the last federal budget, to do what they can to effectively destroy private health insurance in this country. Now, for my constituents in Moncrief, Mr Deputy Speaker, this bill is galling. About 55% of constituents in my electorate have private medical insurance. About 72,000 residents in my electorate have private health insurance. 16,000 families, that is, Mr Deputy Speaker, that have private health insurance in my electorate. Those people are taking the pressure off the public health system. And we all know that in Queensland, thanks to the complete economic mismanagement of the Queensland Labor government, that public health in Queensland is very, very poor, Mr Deputy Speaker. And on the Gold Coast, I cannot possibly even estimate the number of times I've read in local media that the Gold Coast Hospital has been put on bypass because it simply cannot cope with the demand for the public hospital system. That's one of the key reasons why the former coalition government had as a fundamental plank of our policy our belief that Australians should be provided with the incentive to have private medical insurance if they can afford it. Because we know, on this side of the chamber, Mr Deputy Speaker, we understand that for every Australian that's in the private medical system, it eases the strain on the public system. And those opposite in the government never want to acknowledge this fact. So I know from speaking with my constituents, Mr Deputy Speaker, and from speaking with people as I move around my electorate, of their sheer concern that as a consequence of Labor's changes, as a consequence of the bill that's before the House today, we're going to see thousands of people in my electorate alone pushed off the private health insurance system into the public system. So I say to all Gold Coasters, if they think they've got a problem with the Queensland public health system now, if they think that the Gold Coast Hospital can't cope with the demand on their services now, they ain't seen nothing, Mr Deputy Speaker. They ain't seen nothing. because under the Australian Labor Party's reforms that are before this House today, they are about to see a swamping of the public health system by millions of Australians across the board that simply are going to, as far as I'm concerned, basically effectively destroy the timeliness of public health to the extent that it exists now completely. In my own electorate, there are some 2,771 people that are currently awaiting surgery at Gold Coast Hospital. And what's going to happen to those waiting lists, which the Prime Minister so earnestly promised ahead of the last federal election that he would take care of? I mean, his words, "the buck stops with me," still ring in my ears as the Labor Party tried to pretend that they wouldn't harm private health insurance, that they were a friend of private health insurance, that the Prime Minister had a plan to fix the public health system. And what do we see now? We see the proof is in the pudding, as we see the Prime Minister has no plan, has attacked private health insurance, and is in fact going to make public hospital queues completely blow out. That is what the Australian Labor Party has proposed and is executing with this bill before the House, these bills before the House today, that will ultimately cost thousands of people on the Gold Coast their private medical insurance. Now, at the margin, we know the Labor Party likes to claim that they are simply changing the thresholds to ensure that only the wealthy no longer receive the subsidy, that only the wealthy no longer receive the rebate. That's the claim the Labor Party likes to use. That's what they focus group tested. That's the spin doctors telling them, look, put that out there. Let's keep the whole class warfare thing going from the Australian Labor Party's perspective. And let's say this is only about making sure that taxpayers don't subsidise the rich. But the reality is, Mr Deputy Speaker, that as private health insurance has fewer people in it, premiums will go up. And as premiums start to go up, fewer people will have the incentive to stay in the private health insurance system. And so we start the downward spiral that the Labor Party last presided over, Mr Deputy Speaker, which saw private health insurance coverage in this country collapse down to 30%. That's Labor's form, that's Labor's track record, and that again, I predict, Mr Deputy Speaker, will be the consequence of this very myopic Labor Party policy. As more people leave private health insurance, premiums will start to increase, and the more premiums increase, the more people that will leave, and the more people that leave, the more people that will be in the public hospital queues, and the more people that are in the public hospital queues, the longer the waiting lists will blow out. And that is an undeniable reality as a consequence of this policy change that the Labor Party's got here before the House today. It is only the coalition that is prepared to draw a line in the sand and say we will stand up for private health insurance. And, Mr Deputy Speaker, the Labor Party likes to claim that the coalition doesn't have a plan or a policy. Well, we couldn't have spelt it out any more simply for the Labor Party, because this side of the House takes very seriously our commitment to private health, our commitment as well to the public system, which ultimately we're defending by standing up for the private health insurance rebate. Well, I noticed the member for Brisbane laughing. Does he deny that as more people leave private health insurance, that the public hospital queues aren't going to blow out? Is that seriously the proposition that's put forward by the Labor Party? As 1 million people leave private health insurance and move to the public system is just going to cope remarkably, is it? Yes. See no response, Mr Deputy Speaker, because the Australian Labor Party knows that their myopic policy, in the same way it basically destroyed public health in this country in the early 1990s, is exactly the same ideological gutting of this policy that they're seeking to do by introducing this bill into the parliament today.